A priority for the National Cancer Action Team as we move into this new year of 2012 is to continue to press towards ensuring that the delivery and experience of services for patients with cancer in this country at least matches the best in the world. In recent months, or in fact over recent years, we've made significant progress in terms of the improvement of service delivery and experience, but we still have a long way to go if we're to match the best in the world. As a team, our priorities, I think, would be threefold. One would be to ensure that the lives that are currently being lost unnecessarily are saved in the future, and that's about raising awareness of the public of the signs and symptoms of cancer, but it's also ensuring that we diagnose cancer as early as possible. A second priority would be to ensure that the resources that we have available to us are used in the most effective way. And that means looking at things like investment in early diagnosis. It means less investment in inpatient hospital stay. It means looking at programs such as the Enhanced Recovery Programme, different surgical techniques such as laparoscopic surgery for colorectal cancer. And so as a team we're continuing to identify areas in which improvements in the effective use of resources can be made and ensuring that we support the service in making those changes. And the third area of priority for us is seeing what we can do to improve the experience of patients who are suffering with cancer. We conducted a survey at the end of 2010 which showed again that there were marked improvements in many areas in terms of patient experience of care and treatment. But again, there's still significant variation across the country, and we need to do what we can to improve the experience of patients, and whether that's around communications that patients have with healthcare professionals, whether it's about improving the information that patients have about their disease and their treatment, or whether it's in fact improving the effectiveness in the way in which multidisciplinary teams work. These are the kind of areas that we will continue to work in during 2012. And I think the other area that we will be looking at is improving the quality of life for people that are living with and beyond a diagnosis of cancer. And that's an area that I think has been neglected in the past, and an area that we need to give greater attention to in the future. The final area of support that I just wanted to touch on in terms of our priorities for the coming year is the support that we can offer for commissioners. And we've been developing in recent months a commissioning support pack which is made up of three elements. The first is a set of key messages that we believe commissioners need to know about cancer services. The second is the development of service profiles so that services can see how they're performing against a number of metrics, and we've now developed a set of profiles for breast teams and for colorectal teams. And the third area is the development of a set of model service specifications that commissioners can use when contracting for services. We're keen to roll out that support pack in the coming months and to do what we can in terms of supporting new commissioners as they take on the role of cancer commissioning and also working with the commissioning board, who will have responsibility for commissioning specialist services and services for rarer cancers. We're beginning to draw up a business plan for 2012 and 13, and much of that plan will focus on the areas that I've just touched upon. I think it's going to be a difficult year for us, 2012-13, with a lot of transition, much change and continuing uncertainty. But what's important is that we continue to focus on the priorities that I've referred to, that we continue to drive towards improving change. We continue to drive towards the full implementation of the Improving Outcomes Strategy for Cancer, so that we can realise the ambition of having cancer services that at least match the best in the world. There are three things that I think it will be helpful to bring to your attention that are currently towards the top of our agenda. The first of those is the launch of a national bowel cancer awareness campaign. That follows a pilot campaign in the southwest and the east of England. That campaign is now being rolled out nationally and will be launched on the 31st of January and will run until the end of March 2012. The campaign is going to use different media to get across the message about the importance of going to your GP early, and we hope that the campaign will prove to be a great success. I'll be able to give you information on the outcome of that campaign perhaps in the early summer. The second thing I wanted to mention is the next National Development Programme meeting, which is scheduled to take place on the 15th of March, and that's going to be held at the Renaissance Hotel in Heathrow Airport. Details of the programme will be circulated shortly, together with information about how you can register to attend that programme. The third thing that I wanted to bring to your attention is the fact that we're currently undertaking the 2011 Patient Experience Survey. We'll be shortly analysing the results of that survey, and again we'll be able to report on the outcome of it in the early summer. Clearly that will be very interesting to see how the results from the 2011 survey compare with the one that we carried out 12 months ago. And again, I will bring you up to date on the information that we get from that survey in due course.